It's Tuesday, December 17th, and this is the Daily Medical News, where we bring you the top stories in clinical medicine, as well as a closer look at the day's biggest story. I'm Molly Collegio.
And I'm Terry Rudd. Today, the FDA approved the first fully disposable duodenoscope.
Flu activity took a timeout in early December.
Sodium zirconium cyclosilicate tamed hyperkalemia over the long term.
And why heart rate changes during sleep may be a diagnostic tool for depression.
And now, the news.
The FDA has cleared Boston Scientific's single-use duodenoscope, the EXALT Model D. It's the first disposable duodenoscope to hit the market in the wake of the agency's August call for manufacturers and healthcare facilities to move to partially or fully disposable duodenoscope. The goal is to eliminate the risk of spreading infections between patients from incomplete sterilization of traditional multi-use scopes. In April, the FDA reported that more than 5% of samples from multi-use scopes test positive for E. coli or other high-concern organisms. Boston Scientific says the EXALT Model D will be available in the first quarter of 2020. Cost-effectiveness will depend largely on the degree to which the price of the device is offset by the infections it prevents.
The unusually high levels of flu activity seen at the end of November have been followed by a drop in activity. The CDC reports that 3.2% of outpatient visits nationally were for flu-like illness during the week of December 1st to the 7th. That's down from 3.4% the week before, which was the highest November rate in 10 years. But it may be the holidays, not the flu itself, that's responsible for the drop. The CDC says the reduced activity may be influenced in part by the typical fall in routine healthcare visits around the Thanksgiving holiday. Influenza B Victoria viruses are driving most of the early spike in flu activity. That's unusual for this time of year. Since the beginning of the 2019-2020 flu season, almost 70% of positive specimens have been identified as type B. There were 8 states, along with Puerto Rico, at level 10 on the CDC's 1 to 10 scale of flu activity. There were also 4 flu-related pediatric deaths reported to the CDC during the week, bringing the total to 10 for the season.
Treatment with sodium zirconium cyclosilicate, or SZC, led to lasting improvement of hyperkalemia. That's according to an 11-month open-label extension study of the HARMONIZE trial. The findings appear in the American Journal of Nephrology. SZC selectively binds potassium ions in the colon, reducing absorption and promoting excretion. In the original HARMONIZE study, the drug returned potassium to normal within 48 hours, and patients maintained those levels out to 4 weeks. In the extension study, 123 patients with potassium levels of 3.5 to 6.2 millimoles per liter received one of 2 doses of SZC once per day for up to 337 days. 88% of patients achieved the primary endpoint of mean serum potassium levels of 5.1 or lower. We'll be back with more medical news after this message.
An algorithm shows promise at distinguishing differences in heart rate patterns during sleep between people with depression and healthy controls. The algorithm was modeled using machine learning based on more than 1,200 polysomnograms. Researchers at the Royal Institute of Mental Health Research in Ottawa then tested the algorithm on a new sample of 174 people, half of whom were depressed. Compared with the control group, patients in the depression group slept 30 minutes less. They also had significantly longer sleep and REM onset latency, and the depressed patients had a lower amount of REM sleep as a percentage of total sleep time. The algorithm incorrectly identified 15 patients with depression as being in the control group, and it incorrectly identified 20 controls as having depression. That means the algorithm's overall accuracy was 80%, with a sensitivity of 83% and a specificity of 77%. The researchers say their tool could add useful details to psychiatric clinical assessments, and it may offer objective measures for early depression screening. The findings appear in the journal BMC Psychiatry.
And that's it for today's Daily Medical News. You can find the Daily Medical News on Apple Podcasts or wherever you get your podcasts. For MD Edge, I'm Molly Collegio.
And I'm Terry Rudd. Thanks for listening.